Hi guys, welcome to BUAMS TV. Okay, so my name is Sumto. I'm a foreign medical student, and I'll be taking you through thyroid examination today. So just sit back and enjoy. Okay, alright, so talking about the thyroid gland. So the thyroid gland is an endocrine gland that aids in body metabolism. Okay, so the anatomy of this gland. So the gland is a butterfly-shaped gland located at the anterior neck, in front of the second and third chakra rings, or in front of the T5, T1 vertebra. Okay, so the gland has two lobes, the right and the left lobe, and they're connected together by what they call an isthmus. And then in some people, you can also see what they call the pyramidal lobe also. Okay, so when examining this gland, you follow the normal sort of examination, the inspection, the palpation, the percussion, and the scrutiny also. So you should be seen inspecting the patient generally. If the patient is anxious or agitated, then you should be seen inspecting the gland also. The gland enlarged. There's a saying that if you can see the gland being enlarged, means the gland is already 3 times the original size of itself. Alright, so you should be seen inspecting the gland from the front and from the side also, inspecting the gland, checking for any obvious mass in the gland. And after, you should be seen palpating the gland. You'll be palpating for tenderness, checking for the differential warmth, checking for tracheal centrality, checking for if the mass is, if it's hard, if it's nodular, if it's smooth. So once be also palpating for if there's any lymph node involvement, and also checking for the carotid position also. Then also you should be seeing percussing also over the sternum, checking for if there's any dullness, because if there is a there's a vitreoretinal involvement of the gland, there will be dullness on percussion. Then you should be seen scrutinating the gland for any carotid breath. So after examining the gland, then you should be seen also examining other parts, the peripheral involvements that this gland has on other parts of the body, like the eye, checking for endothalmus, checking for lid lag, checking for any ophthalmopathy in general. Then you should be seen checking the hands for thyroid acropathy, checking for primary edema, checking for if there is any tremors. You should be seen checking for the pulse and the blood pressure also, and checking for if there's any pre-tibial myxedema. And then you should check the reflexes also, because it also affects the reflexes also. So yes, so now to the examination. Okay, so onto the examination now. So the first thing you should be seeing doing is you want to take a consent also. Okay, so you would tell the patient, okay, what the examination is about, and you also ask him for consent also. Okay, so you see me do that now. Okay, so good afternoon, sir. Good afternoon. So my name is Sumto, a foreign medical student, and I've been asked by my examiner to examine your neck, your anterior neck. So it involved me touching your neck, and also telling you to carry out some instructions also. Okay, but you shouldn't question any harm or discomfort. May I go ahead? Mm-hmm. Okay, so you've taken the consent now. So then the next thing you should be seeing doing, if you can also ask for chaperone also, in cases that need be. Okay, so the first thing you should be seeing, you want to also expose the patient well. You get, so the patient is wearing something like a headgear or something that covers the face of the neck. You tell the patient to actually take it off to adequately expose the patient well. Alright, so after we've done that, then we want to be inspecting the neck. As I said before, so you follow the procedure, IPPA. So the first thing you want to do is to inspect. So on that inspection, you're inspecting the patient generally. So I check your knuckle, okay, is the patient anxious? Is the patient also agitated? So as you can see, the patient is not anxious or agitated. So then you should be seen also inspecting the anterior neck. Right, so you should be seen stooping low to the neck. You check in front, you also check at the side also. Alright, so I said before, if you can see an obvious mass, that means the mass is already 3 times its original size, but there is no obvious mass here. Okay, so after you've seen the mass, so we are still inspecting. So you tell the patient to take him to swallow. So I will tell my patient, okay, so can you just take a gulp of water and still leave it to your mouth until I give you a chance to swallow it. Okay, good. So it's important to tell the patient to keep it in the mouth first before attempting to swallow. Okay, so I'll be checking the neck now. Okay, so please, can you swallow? Okay, so you are checking for the gland movement during swallowing also. Okay, so the next you want the patient is to stick out his tongue. Can you stick out your tongue, please? Okay, thank you. Thank you so much. Okay, so if If the gland moves on swallowing and on tongue retraction, that means it's probably going to be a thyroid cyst. But if the gland moves on just swallowing alone without tongue retraction, that means it's going to be an obvious thyroid mass. Okay, thank you. So I'm also going to inspect for if there's any changes around the neck also, if there's an obvious mass. Okay, so but I can't see any changes there. Okay, so then I'll be going forward to palpation. Okay, so I'm palpating the mass for tenderness, palpating for differential warmth. Also be checking for any there is trichal centrality also. So is there any part that is paining your neck?
No.
Okay, so I'm palpating the neck now. Okay, so okay, there's no pain. So I'll also be checking for differential warmth. So in checking for differential warmth, you would check. So sorry, you would check the normal side. Then you check the side that seems abnormal, then check the normal side again. Okay, so there's no differential warmth here. Okay, so I'll also be checking if there is a mass. They also want to check if the mass is attached to the overlying skin. When there's no mass, so I won't be doing that also. And I'll also be checking for if the trachea is central. Okay, so okay, yes, trachea is central. Okay, so now I'll be going to behind the patient now to examine the gland, because you can't do that from the front. Okay, so you also want to position your hand aright in examining the gland of the patient. So your thumb should be seen behind the patient's ear, and then your pointing finger to behind his chin. And then you should be seen, okay, palpating the glands. So while doing palpating the glands, you should be seen stabilizing one part and palpating the other side, as I'm doing now. Okay, so you'll be checking, okay, if there is a mass, is it hard? Is it nodular? Is it smooth? You get, so also be doing that. Then you also tell the patient to also take water and swallow also. Please, can you take water? Just keep it to your mouth, please. Don't swallow yet. And please, can you swallow? Okay, so we're checking, okay, can you feel below the mass to know if there's any retroexternal involvement of the thyroid mass? Then after, I'll also be checking for if there is any lymph node involvement. So you should be seeing palpating for the lymph nodes, the submental lymph node, the submandibular lymph nodes, the preauricular lymph nodes, the post-auricular lymph nodes, then the anterior cervical lymph nodes, which there are groups of it, also the posterior cervical lymph nodes also, and also the occipital lymph nodes also in the head also, and also the supraclavicular lymph nodes also. Okay, so when you are done with that, you also want to check for if there is any carotid pulsation. Okay, so where that you be seeing, because you don't want to be seeing palpating both carotids at once, because you can reduce blood supply to the brain. So you should be seeing with one hand on the head, and then the second hand palpating for the carotid pulse. Okay, yes, so I can feel the carotid pulse. So in a case whereby you can't feel the carotid pulse, so that's called the Berry sign. So if Berry sign is positive, that means there is most likely a malignancy of that mass that is infiltrating the carotid sheath, preventing the flow in the carotid artery. Okay, so after that, I also want to percuss over the gland also to check if there is any retroexternal involvement of the gland. Okay, so you should be seeing percussing over the sternum. Okay, so if it is dull percussion, then that means there might be a retroexternal involvement also. Then also after, you should be seeing auscultating for carotid debris. Okay, so sorry. Okay, so there's no carotid debris. Okay, so after this, Then we're done with examining the gland itself. So we also want to examine other the peripheral involvements of the thyroid gland also. So like the eyes. So we'll be examining the eyes now. So the first thing we want to check is if there is bulging of the eyes, exothermos. So I'll be telling you to, can you can you bend your head a little bit? Okay, so I'll be looking at the eye from this side. If you can see that white sclera of the eye, then that means there is bulging of the eye, which is exothermos. But I can't see that here. Okay, thank you so much. So I'll be going to the front of the patient now to check for lead lag. So while checking for lead lag, you would position your hand on the head and then take the patient to follow your hand. So sir, can you follow my hand, please? Do it again. Okay, so if there is lead lag, the upper eyelid needs to go down as it's meant to be. So you'd see more of the sclera while doing that. Okay, so there's no lag in this patient. Then I also want to check for if there's any diplopia. So sir, can you follow my hand, please? So I'm doing the H shape. So please follow my hand, please. Okay, thank you. So hope you didn't see any double, and we're not seeing double in any pants. Okay. All right. Amazing. Okay, thank you so much. Okay, so after that, we'll be examining the hand also. So can you see your hand also? Okay, thank you. So the back of your hand. So also I'm checking for thyroid acropathy, which you see in the nails. Okay, so it doesn't have that. So I want to check for if there's any if he has sweaty palms or if there is any palmar erythema, which he doesn't have. Okay, they want to check for if he has tremors. Okay, so I'll be getting the piece of paper. Check if he has fine tremors. I just want to put up the fan now, so it won't interfere with this test. Okay, so he doesn't have fine tremors. All right, thank you. Then you also want to check the pulse also. Okay, so thank you so much. So you check the pulse and then you also count the pulse. Because in hyperthyroidism, you have tachycardia, so the pulse will be very high. And in hypo, it will be the opposite. Okay, so then you should be telling the patients that you also want to check the blood pressure also, which is very important. Okay, so after doing this, then you also want to check the legs also, because in patients that have hyperthyroidism, they have what they call the pretibial mixed edema. So you should be checking the legs. So can you use up your leg? Use up your shoulder for me. Okay, thank you. It's a couple one, sir. It's a couple one, sir. That's fine. Okay. So you should be checking the leg for pretibial mixed edema and running your hand through the legs for it. Okay, so he doesn't have any. In pretibial mixed edema, the edema they have is a non-pituitary edema, and it's usually shiny also, and is at in front of the tibia. So he doesn't have any of this also. Then you also want to check for proximal myopathy. Okay, so can you do like this? And can you stand up? Okay, thank you so much. So it doesn't have any proximal myopathy. Thank you. You can sit down now. Thank you so much. Okay, so last thing you want to do is you want to check for reflexes also. In people that have hyperthyroidism, they have hyperreflexia or hyporeflexia. So you shouldn't finish your exam without checking for reflexes also. Okay, so I'll be checking the biceps reflex. So you should be seeing hypertrophy for the tendon. So you should be looking at the bicep muscle while doing the test. Okay, thank you. No, relax your hand. Okay, thank you. And also check for the patellar reflex also, the knee reflex. Okay, so you should be looking at the thigh muscles here. Okay, so that's fine. Yeah, and you can also check for the Achilles tendon reflex also. So when you are done with this, then you will thank your patient. Thank you so much, sir, for the examination, and then you would probably tell the patient to suit your support. And I think that's the end of the examination. Thank you.